South Africa heading towards its sixth wave of COVID-19. One doctor from Durban wrote on their Facebook page that they've noticed an uptick since Monday. But according to the latest National Institute of Communicable Diseases weekly COVID-19 hospital surveillance report, new hospital admissions have decreased by 30%. So for more on this, we're now joined by medical epidemiologist from the NICD, Dr. Sibongile Walaza, this Friday morning. And Dr. Walaza, thank you for your time and good morning to you. Now, that's the concern, I think, also when we take a look at the latest numbers, which nationally, they're just over 2,000 cases of COVID. Is there a possible sixth wave looming?
Good morning and good morning to your listeners. Again, I think it's important just to highlight that currently testing is currently very low in South Africa, in the country. And this does make it difficult, or just present difficulties in us interpreting the data that we have, and also just in terms of comparison to previous waves. But as I said, testing is very low. However, we did see an increase in percentage of cases testing positive in the past few weeks, which has now since stabilized. And this suggests that there was some increase in transmission. However, this has now gone down. And again, also just to mention that with the small increases in percentage testing positive, we also did see some increases in some of the cases in some of the provinces. But these numbers are way below what we've seen previously. And it has not translated, as you have mentioned, that it has not translated to severe disease. So we've not seen an increase in hospitalization or deaths.
Right. With the numbers you're currently seeing right now, Dr. Walaza, does it inform that there could be a need for more testing to take place?
So I think as clinicians, clinicians do know that when patients present and they suspect that this patient is suspected or present with symptoms of COVID, they should test, and that should continue. But then, there's no room for just blanket testing, and so as patients present, it should be good for people to test the cases that are presenting at facilities.
Also, when we talk about, COVID-19 testing and the numbers, we can't have the conversation in isolation to vaccines. How are the numbers looking just in terms of those who are taking their vaccine? We know that government hasn't necessarily reached their target, but as the NICD, do you have some idea as to how those numbers are looking in terms of those taking their vaccine?
Unfortunately, I'm not able to give you that update. I don't have the numbers of, the percentage that is vaccinated. But again, we still want to encourage people, as you've seen, that in terms of, even though there's increase in cases, in percentage testing positive, we think that there is increase in transmission in the communities, but it's probably mild cases. So it's suggesting that there's high levels of immunity. So we encourage those who are at high risk of severe disease, if they've not vaccinated, to go and vaccinate or to go for their boosters.
Right. Oftentimes when we have conversations with the NICD, it's also because, Doc, there might be a new variant looming, maybe not necessarily in the country, but studies have been conducted in other parts of the world. What do your studies show about any variants that could possibly be mushrooming elsewhere in the world?
So I think, as the pandemic is ongoing, so obviously we do monitor any variants that are increasing, and at the moment there's no worrying variants that we're seeing, and continue monitoring the variants. But again, it also talks to the point that because there's a decrease in testing in not just in South Africa, in other countries as well. The number of samples that are being sequenced or testing are also going down.
Yeah, and just to reiterate that point.
But currently, there's nothing that is worrying.
All right. And just to reiterate that point around the importance of testing, nonetheless, especially because we're going into festive season, are there any symptoms that you would advise as, the NICD, that should you experience any of these symptoms, perhaps it's also a sign that there's a call for concern for you to go and test? Can you share them with us, please?
So COVID-19 is a syndromic, so patients present with a wide variety of symptoms. So they'll have most of the cases, or some of the cases, will have respiratory symptoms like cough, fever, sore throat, but also some of the patients will present with just extreme fatigue and tiredness. So if people are just feeling that, they're feeling out of sorts and they're not able to, to continue with their daily activities, then this is one of the things that they should consider and to go for testing. But it does vary from person to person. And also highlighting the point that also we do have cases that are completely asymptomatic, that don't have any symptoms, or that don't have present with any symptoms.
Well, Doc, I'm hoping the South Africans do heed the call you're making today to continue testing, just to know and to be sure of what's happening with their health and their body. That's where we'll leave it at this point. Dr. Sibongile Walaza, medical epidemiologist from the NICD, talking to us about COVID-19. No concerns at this point, but also saying that the rate of testing is quite low, and the numbers they're seeing in terms of South Africans coming to test has obviously decreased over the past couple of months. Encouraging, though, that you should continue to do tests and just check that you are in good health. All right.